Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our series called Pláticas. Today, we'll be talking about Latino wellness. And more importantly, NALBA as a nonprofit organization is dedicated to the well-being of Latino families, individuals, and communities in New Mexico and throughout the U.S. Our mission is to address the disparities that impact the Latino community, their well-being, and their behavioral health. We're so excited to host today's Facebook Live series on how Latinos and their families can and do take care of their emotional, physical, and spiritual well-being. In a little bit, I'll be introducing our guest presenters. Each month, we host this particular Plática series because we invite professionals who are in public health, in the medical field, behavioral health, and other disciplines to come share with us what they do, about the resources they offer, and how we can connect individuals to their incredible organizations. But they also get to share their insights, talk a little bit about themselves, and what it is that they can provide in terms of resources. So to get us started, I'm going to go ahead and introduce our great presenters today, and then I'll tell you a little bit about how our pláticas work. But again, let's go ahead and begin with the introductions. So it really gives me great pleasure to introduce Rose Nelson, who is the Senior Director of Health Equity and Behavioral Health Services for Western Skies Community Care here in New Mexico. She holds a bachelor's in psychology and Spanish and a master's of arts in counseling educational psychology from New Mexico State University. So go Aggies, I would probably need to say and add to that, I suppose. She's an independently licensed mental health counselor and has worked in the behavioral health field for 15 years. And we hope she stays in there for another 15 years, by the way. She's doing some incredible work for our state, and all of us should know Rose Nelson firsthand. She's a first generation American born and raised here in New Mexico. She is passionate about family and the importance of access to mental health care for all. And today, she will help lead the conversation about a subject that's very important to all of us. So she'll be joined by her colleague, who I want to now introduce. And it's Amalia Ontiveros, who is a certified community health worker with the Member Connections teams for Western Sky Community Care. So for those of you who know how community health workers, they are probably one of the most trusted individuals in any given community in our state and across the nation. So it's great to have Amalia here with us. And of course, a little bit more about her. She's been doing this work since the year 2000. So she's very experienced, and more importantly, she's here to kind of impart the same messages that Rose will be talking about, and we'll be asking them questions here in just a bit. I want to just simply say she's working in the community of Doña Ana. As you all know, that's in southern New Mexico, in the great county of Doña Ana, because there's also a village and a county by the same name, by the way. And she's very committed to helping New Mexicans have access to the resources they need for a better quality of life. She attained a bachelor's degree in social work from New Mexico State University and is in the process of obtaining her master's degree in social work through Western New Mexico University. And I probably want to talk to her afterwards because our organization is looking for students just like her, but that's for a separate conversation. So to both Rose and to Amalia, welcome. It's just great to have you here. And today you will be talking about a topic that just excites me. It really talks about something that we rarely focus on. But before we get into those questions, here's how the Plática works. I have a few questions to get us started. We will get questions or particularly comments from our live Facebook audience, which I'll share with the two of you and make sure that we have a chance to respond to those. But I'm going to start with the first question to both of you. And Rose, if you don't mind, I'll start with you. And so we'd like to ask you to tell our listening audience a little bit more about yourself, and then we'll have Amalia do the same. Thank you for sharing your credentials, but now we really want to get the real scoop of Rose Nelson and Amalia, because this is a very personal plática, right? We get to really get to know you and make a connection to you. So Rose, welcome.
Thank you, Fred. So very thankful for our partnership and our ability to partner in presenting important topics as we're talking about today. A little bit more about myself. Again, born and raised in our beautiful state of New Mexico. The topic today is specific to loneliness and how it impacts us and how community connections are so important. And I think to share a little bit about my upbringing reflects why this is important to me as a person and to my family. So I was raised by a single parent. The reason that I was raised just by my mom, my older sister, and I is because my father passed away. And he passed away abruptly, and so my mom was left raising two girls that were 3 years of age and younger. Besides the emotional impact of losing my father, her husband, and raising two little girls on her own, and only speaking Spanish, loneliness without a doubt was part of her life at that moment. But whenever she tells this story, she always says, what really got her through it was the community support, either support through a small amount of family that we did also have in New Mexico, some distant aunts, things like that, but through church and through some community organizations. And so I personally have lived the value of finding those community connections to support you through not only difficult times, but through normal everyday times, right? So I'm really excited to share some information on this topic and help support others and encourage the conversation of loneliness and how we can do things to help support others that may be lonely, as well as ourselves. So thank you for having us today.
Oh my God. I always appreciate when we make a personal connection to our subjects, right? The topic, because what happens is it's a recognition that these things are all so valuable to talk about. And it really kind of connects us to these realities, these things that we share. And our stories oftentimes kind of tap into that in a way that's very powerful. And I know our Facebook audience is very much connected to people's stories. So Rose, thank you so much. And let's ask Amalia the same question, right? Is just to have you say a little bit more about yourself. So Amalia, please go ahead.
Thank you, Fred. So a little bit about me. I actually was not born in New Mexico. I was actually born in Juarez, Mexico. And my family and I, we came into the United States maybe when I was about 4. So I've been here since then. I went through the process of, going through the naturalization. So I am naturalized, a naturalized citizen. My family, my mom, is also a single parent, Rose. I did not know that. But yeah, she is a single parent, but we did have extended family living. So of course, several family members in one household. That was me growing up. But I think what, the topic of loneliness, I think for me, what led me into the work that I'm doing, and even, as a promotora and a social worker, was really connecting individuals to resources, especially coming from, my background, whether that's, actual resources or getting them connected to other supports, that other community members. I thought, that was very important to me. Like I said, something that I've been doing, I know that I put since 2000, but really, I think since I graduated, I've been in the community or working with, a community organization since then. So thank you.
Wow, very cool. Oh, wow, that's really awesome. Thank you for sharing that. Actually, I have one of our staff members also from Juarez, Mexico, and just all I can say is we love him to death. He's an incredible worker. But more importantly, is what to say is that you reminded me, and so did Rose, about the significance of our natural support system. Because we rely on it so much, and it's there from the time we're born, and it's because of the way the family network works and the people around us, extended family members, and those supports, like our faith communities and the programming that's available to help us with the times where in our life these resources were developed for a purpose, right? And so it's nice to be able to now really get into kind of our subject matter. But before we start really talking about that topic of loneliness, I really would like to have you say, Rosa, more about Western Skies Community Care. The amount of services, the array of work that you do, the campaigns, the initiative, the outreach, the engagement. All I could say is you touched many lives here in New Mexico. So I want to do a shout out to Western Skies Community Care, but it's always nice to really kind of have someone from the organization describe your services and really be able to encourage others who would benefit from the services to learn how to be able to access and be able to be part of the plan for services there at Western Skies. So let me give you a little time to say about that, and then we're going to just move right into the subject for today's Plática. Go ahead, Rose.
Perfect. Thank you, Fred. We absolutely appreciate the opportunity to talk about the wonderful company that we work for. It is called Western Sky Community Care. Western Sky Community Care is a managed care organization in the state of New Mexico. And really what that means is we're a company contracted through our state to support people that are on Medicaid. And so we're there to educate people in New Mexico that are on Medicaid about the benefits that Medicaid provides, because Medicaid does provide access to physical and behavioral health services as well as many other things. And then as an individual company, we also add additional services to what Medicaid can provide. And we'd like to highlight some of those today. So I'm going to have Amy talk a little bit about what's called our value-added services. And then we're also going to add a link so that people can go to our website and read a little bit more about them, because we don't have enough time to cover all of them, but Amy will highlight a few. Go ahead, Amy.
Sure. A little bit about our value-added services, or what we call VAS, is, some that we wanna, I guess, highlight are really is our transportation to pharmacy benefit. And so a little bit about that one is more for individuals that are being discharged either from the hospital or a behavioral health inpatient facility, skilled nursing facility, things of that nature. They have that benefit where they can go and pick up their prescription at the pharmacy, right after their discharge. So that's an important benefit. And again, something that we want to highlight for those listening. The other is as well our post-discharge meals, The post-discharge meals really does, support, again, those individuals discharged from the hospital or an inpatient stay, where they can get up to 10 meals delivered to their home. And I think, again, that's a really nice benefit for individuals to access. Sometimes, especially if they don't have other family members in their home, they can provide that additional support. That is a great benefit to get some of those meals to them, nutritious meals. And then another one that I did want to highlight is our heading home respite bed benefit. And so, of course, for those individuals that are eligible, it would cover room and board at facilities that are, part of the heading home respite care program. And it is a 24-hour care, that they provide services 24 hours. And that also includes, managed medication management. It includes individual and group sessions, transportation to their appointments, care management, specifically on the discharge planning before they, go back into their home, financial support, housing, and again, access to community resources, just again, providing that support to them to continue with, with their care. I don't know if I'm forgetting any others, Rose, that you wanted me to highlight.
those are great. And Amy, the ones that Amy touched on really are addressing social determinants of health, right? So we've got transportation, we've got food insecurities, and we have housing. There's many more examples, so please take the time to look at the link and explore what we can offer. And I think one of the important reminders is, again, these are available as part of being one of our Western Sky members and having access to Medicaid. So Medicaid does really provide that support to help us be as healthy as possible. What the most important thing is that people know this information so then they can access the resources. And that's one of the goals here today as well. Yeah.
Wow. Yeah. Well, you are right on the mark to connect people to those resources. There's a space between the person and the resource. So to connect them together is in fact a way to ensure that their well-being continues, right? Being able to continue without interruptions with their medications. And then the challenges that people who have limited income will be facing, which is maybe they no longer drive. The person maybe doesn't have a private vehicle, but all of those barriers and limitations shouldn't keep a person from taking care of themselves, right? And you are right on the mark with addressing the basic needs that people have, because in some measures, that's really what impairs people from being able to stay well or get services. And that connection is such an important and vital part of a healthcare delivery system. So kudos to you and the organization for recognizing how all of that can be done and the approach they use through what you call value-added services. Well, here we are. We get to now really kind of hone in on something that oftentimes might keep people from getting help. And so let's talk about that. Let's explore this conversation around loneliness. And thank you, of course, for highlighting the fact that in Loneliness Awareness Week from June 12th through the 18th, this is the opportunity to really have these kinds of conversations so we can share with the community how this particular aspect of their lives relates to how to get help. So my question to the two of you is to talk about why is being socially connected important? And I'm going to start with you, Rose. So please, if you'll get us started, and then we'll go over to Amalia.
Yeah, that sounds great. As you mentioned, Fred, Loneliness Awareness Week is this week. We're right in the middle of it, right? And what some of you may be asking is, what is Loneliness Awareness Week? I've never heard of that. And what's interesting is it's become a bit more of a topic of conversation due to the pandemic, right? Because yes, people have been lonely since the beginning of time. We're human, and it's a human nature to want social connectedness, and that's the norm. Everybody understands that. But what people have a more innate understanding of now is, if you're lonely, how does that impact us as a human, right? So if we need social connectedness and we don't have it, what does that do to us? And Loneliness Awareness Week is to bring awareness of how loneliness can impact us as human people, right? No matter the race, gender, ethnicity, it doesn't matter. Loneliness impacts all of us, and what we can do about it. So it's bringing awareness to that. So I think one of the most important things is recently the U.S. Surgeon General put out an advisory on healing effects of social connection and community. And so we're going to add that link to the Facebook chat so everybody can take a look. There's tons of information in there. Please take the time to review that. I'm just going to highlight a few things which really caught my attention. And so there are statistics in there because there's been many studies. And so this is, based on people doing research on how loneliness impacts us as people. And so some of the statistics, so lacking connection can increase the risk of premature death to levels comparable to smoking daily, which means if you were to smoke cigarettes every day, that's the same impact. If you're lonely every day for a long period of time, that's going to impact your health in the same negative way. So that was I couldn't believe it when I heard that. That impact is so huge because we understand now the negative effects of cigarettes, right? And so to think that being lonely would have the same negative effects on our bodies shows how important it is to help people, right? Not be lonely and give them resources so that they can have that social connection. Another statistic, poor social relationships, social isolation, and loneliness can increase your risk of heart disease by 29% and risk of stroke by 32%. Now, those are real percentages studied and found and reported in the U.S. Surgeon General's advisory. So again, negative impact to our physical bodies, not just our emotional well-being, but our physical well-being. Adults who report feeling lonely often are more than twice as likely to develop depression as adults who report rarely or never feeling lonely. So there's the impact to our, our mental health. And I think that we connect with a little bit more. We're like, well, that makes sense. If you're lonely, you're sad, thus likely depressed. But the physical health impacts, I think it's somewhat shocking. People with strong perceptions of community belonging are 2.6 times more likely to report good or excellent health than people with low sense of belonging. So again, social connection equals healthier, happier people. Loneliness equals negative impacts to physical health and mental health. And so the reports are very clear and tell a story, an important story. And then obviously very important last statistic, children and adolescents who enjoy positive relationships with their peers, parents, and teachers experience improved academic outcomes. And I think we can all agree how important teachers are because they spend so much time with our children. And so having that connection and promoting that and telling your kids, like, your teacher is an important relationship with you. They are there to teach you, but they're also an important adult in your life, to engage with and ask for help. And so encouraging that relationship really does help kids succeed in school. So anyways, a lot more information at that link. So I do encourage others to take a look and gain some knowledge and hopefully encourage them to engage with others about the conversation.
Wow. Yeah. Well, Rose, thank you for sharing the link. It is in the live Facebook chat, and the nice thing about those links is they're so easy to open and use. Of course, that's for folks who are IT friendly, right? But you can always ask the 8-year-old in the family or the teenager in the family to download it for you, and they'd be happy to do it. So just know that you can get the information a lot of different ways. But what was very impactful, as you said, is the physical impact that loneliness has. The fact that it's been studied and that there's an effort to understand how to deal with these barriers and challenges in order to improve people's quality of life and their well-being is spot on for why this particular Plática is important, because you're bringing us information, you're delivering that message, and we want to be able to have our listening audience be able to benefit from that. And Amalia, I was noticing you were like totally listening to all of that information, and you were probably thinking about how isolation and loneliness, as Rose said, coming out of this serious pandemic, which we're still engaged with, and how that still is a factor right now in relationship to people feeling lonely. And how have you seen, as you connect people, how that might impact that loneliness? Maybe share a little bit more.
Yeah, I mean, when I talk with our membership and they are, expressing, some sort of, sadness or stress because, COVID affected the, being isolated, but it also affected a lot of other areas on how to manage, paying their bills and how to, get to, seeing the doctor that, cut those services a lot as well. And so getting them connected again and letting them, or actually just being aware of what is available to them internally within Western Sky Community Care, and then as well as in their community, and just, giving them, connecting them again to those resources has, I've seen, a positive impact again. But again, I feel that it's something that, we have to work with one individual at a time. And of course, these pláticas and things like that hopefully will help others, getting them reconnected. And, if they are wanting supports, please give us a call and we will be more than happy to help them identify, what is their barriers and how we can provide those supports to them.
Oh, that's awesome. When you think about who is experiencing loneliness, it's really across the age spectrum, right? And so bringing this to our attention in this way is about something that the natural support systems have oftentimes helped to address, right? Those people in our closest proximity. But what I appreciate about Western Skies doing is being able to say there may be some folks who are isolated from their natural support system, and it helps to kind of fit in those gaps where folks can learn about a very important resource. Because if you think about the notion of how long our lifespan is, in this country, we have a longer lifespan, a life expectancy that's longer, because the more we have access to healthcare benefits and programs that address our well-being and our wellness, the longer our lives are. And the quality of life then is also higher, right? And that's when, in fact, people benefit from these resources. So this has been just great to hear about how this is so important to particularly our communities where this may be the case. Rural frontier states, because people live farther apart from each other, it can probably create gaps in time between how people see or visit their families or friends or their own network. I want to do a quick shout out to one of our colleagues who is she just make sure that she doesn't miss these pláticas. So Dolores Macias, I want to say thank you for joining us today. And she always has great comments, input, suggestions. So I'll share a little bit more of that with all of you in just a little bit. But let's continue this conversation about loneliness. So when we think about what that actually looks like, if you think about, let's say, a mom who just gave birth to a child, right? Is how might she be susceptible to some of this loneliness? What might that look like? Because it's a very vulnerable point in the life of a mother and a child. And when you think about the services you're providing as an organization, how could you then kind of weave in supporting that mom who might be experiencing loneliness? So, Rose and Amalia, I'd love to hear your perspective on this, because it kind of fits under the description around maternal health, right, in many ways. But I know that the organization is doing such great work to really bring to attention the importance of that particular period in a mom's life, especially with newborns. But anyway, say some more about that if you wouldn't mind.
Rose, I was going to say what comes to mind is our Start Smart for Baby program, where the team reaches out to those individuals, checks in with them, sees how they're doing, making sure that they're following up with their doctors, but as well as getting them connected again to, as you mentioned, our baby shower programs, and as well as any other resources that they might benefit from within their community. So that's what kind of like came to mind, is having, again, if we're thinking of isolation, having those interactions, in a monthly basis or, bi-weekly basis, depending on that individual and their needs, I think would be very beneficial, particularly with isolation. I
Yeah,
don't know.
and I'll add, that's great, Amy. Yeah, our Start Smart for Baby program is just amazing. And they're NICU nurses with experience, not only with mom, but the baby's health. But one of the important things that they do for our moms is they assess postpartum depression, which we know is something really important, right? That we should ask the questions, we should provide the support, and that those questions really will help us learn, are they lonely? Are they exhibiting symptoms of postpartum depression? How do we provide support? And then in addition, one of the things that Amy brought up earlier, which we forgot to highlight, which is really, I'm in love with this value-added service, the post-discharge meals. We actually also have that for moms. And so when they have the baby, we don't just provide food for like the one individual mom, because normally if you have a baby, you might have another child or two already at home, right? And then a husband. And so we actually provide the meals for the entire family for a period of time after mom goes home with the new baby. So it doesn't have to be the first baby, right? So it's providing that support, for the family, so that food is taken care of during that really crucial first, period when the baby goes home and everybody's just trying to, kind of come back to a normalcy within life. We really do think through what do moms need, what do babies and families need, and try to get creative on how to support our families and get their feedback. Say what would help you, and so through that feedback is how we've developed these programs to support all of our members, no matter the life situation that we're in. And I have an additional example, Fred, but I don't want to just move away from the maternal health if you have other questions about it.
Well, I was just very fascinated by the fact that the way you described the approach, which is to think of it in the family context, right, or the household context, because it's not just one individual, but really it's impacting the entire household of the family unit in whatever constellation that family looks like, right? But I really appreciated hearing that, because I have heard oftentimes that people experience a great deal of stress during that period of time. The mom herself has a number of circumstances to have to contend with, right? That she would be worried about, without a doubt, the fact that at that point in time she's having to really be ready to deliver a child, and so the stressors in the family, the younger children, our other children, all of that's very impacted because of the fact that one is it impacts the entire family. So I appreciated you all bringing attention to that reality. It's a powerful service, but it's benefiting the family, and it takes care of the kinds of basic needs issues that families do need and do struggle with, because that's the reality today, But it sounds like you had some other examples that you can share, and we'd love to hear those, because I think here's what's powerful about this service. One is it's demonstrating that, and I think you said it best, is I love the question, the way you phrased it. What do you need? Right. The power of that question is just amazing, because the person opens up their aperture of their life to you. So that kind of creates a connection to the organization, the person serving that person. But it's true, we all have needs. And that very basic question is so powerful. It's a way for being able to be of service to others. But anyway, say a little bit more about other examples, Rose.
Yeah, thank you, Fred. We have so many, but I think one that is very relevant to what we've been through and what we continue to go through with the pandemic is same idea. We kept asking, what do our members need depending on the different situations? And one of the situations that we came upon was our members in nursing homes during the pandemic. And so many things changed during the pandemic, including being able to see your loved ones. So if you had someone in a nursing home, you may have not been able to go see them in person for a while. That is the definition of someone being lonely. You used to see them and now you can't go see them. It was very hard on our members. We were very well aware of that. Of course, we understood the importance of them staying healthy, with some chronic health conditions they may already be dealing with. And so in the pandemic, a lot of things changed, and social changes to even how we socially interact. And so one thing we did is we provided tablets for all of our members in the nursing homes in New Mexico so that they could do what we're doing now, Zoom calling with their families, and the nursing home staff was able to help them because obviously they may not be too, adept to using a tablet, but it was a simple Zoom button. We were able to set up the tablets to do just very simply, and the families could use their phones or whatever, and they could talk at least like this, right? Versus being in person. But so it gave them the ability to connect socially. And it also gave them the ability to have additional applications on the tablets that supported their cognitive health, right? Just playing social kind of games on some of the other applications we have, like My Strengths, which is kind of like a coaching app, right? So for self-care. So how am I feeling today? Kind of rating yourself with smiley faces is something very simple. But then depending on what you rate, it gives you some tools and some things to look at and even some videos to watch. So educational, helps with cognitive, just kind of keeping your brain active. And it's a good distraction, right? During that time, we all really needed something like that. And so again, trying to be creative, asking what our members need, but saying, okay, how are we going to do this? Because we can't do it the way we used to. How are we going to do it now? Right. And so that's constantly what our company does is we ask the question, we're innovative, we think of an answer and we move forward. And I think that idea was just so well received and our members really benefited from it. And happy to say that it reduced social isolation and loneliness as much as possible, through the tablets. So, yeah.
Well, it's that kind of creativeness about how do you leverage technology and in a modern time in a situation where in fact people are going to be experiencing these very things that you described, because those facilities become such a major safety net, a safeguard for a person's well-being 24/7. And then what happens when there is a pandemic? And we all saw that happen. And I think that's in part how people's awareness has grown about our personal well-being, about our mental health, about isolation, and how that has impacted all of us, right, in one way or another. So those are excellent examples. And Amalia, you probably are probably able to kind of now recollect a little bit about in the work that you do as a promotora, right? Where in fact, if people maybe didn't even recognize their own loneliness, maybe you did, right? A lot of times what happens is because of just the way things move and shape and impact our lives, we may not be realizing we're becoming much more isolated, or that we're moving away from the connections that we had, either because of a health situation or because we're experiencing some grief or loss, or there are just changes in our life in general, right? When we're very stressful, we tend to kind of withdraw, right? Because we're trying to sort through things. But you probably have some examples of how it is that loneliness did service and how you were able to kind of be of support to a person experiencing that, even though they maybe didn't call it that.
Yeah, I think a lot of the work that we do is, as what we're doing right here, is through natural conversation with that individual, identifying, what their needs are and also what their barriers are. Through that process, we, complete what we call assessments. And I think, based off of what they're telling us, what they're experiencing, whether that's, again, we might not, or they might not have called it depression, but maybe they're, experiencing more moments of sadness. Maybe, they're experiencing anxiety, whether that's external factors affecting them. But internally, getting to hear a little bit about that individual situation and what they're experiencing and how that's been impacting them in their lives, we can definitely connect them to resources internally within Western Sky. So that could be, with our disease management program, which, consists of individuals focusing that might have some depression, and getting that support with them, or if they are struggling with a lot of chronic illnesses, again, we have individuals that can provide that support to that individual. We have care coordination if, maybe they're, experiencing a lot of factors, not just behavioral health, but also physical, and it's impacting both. And, again, we know that it's a mutual thing, right? That it affects both. So getting them connected to care coordination, just to help them meet their life, their medical goals, whatever those medical goals are for them. It's very specific to that individual and what their goals are. So we really like to focus on that. It's not, it's meeting them where they're at and then getting them that support that they need. Also, internally, we do have our tribal liaison individuals team that helps, again, connecting their community with resources and supports, and that's very important, and providing that culturally sensitive language, and making sure that they get that support in their community. The other would be, even with us, with our member connections department, which we have both community health workers, so promotoras like me, but we also have peer support specialists as well. So we do have a variety of supports available to that member, that individual. And again, it all starts with having a conversation. So
That's exactly right. Yeah, I always say that sometimes we overlook the most important, significant questions that we ask, because anyone and everyone, oftentimes when we see each other, oftentimes the first question is, after we say hi to each other, is, how are you? Such a powerful question, right? Because the person now has a choice, an opportunity to say, I'm doing pretty good most of the time, but there's just some days it's a bit of a struggle. And it's very candid, but it's very genuine, it's authentic. But it cues us to understanding that that's right. There will be some times where things are a little bit more challenging, but it's also an opportunity to say, yeah, it's great when things are good, but then on the challenging days, sometimes we could probably benefit from a little bit of someone listening to us, or someone just being there just to kind of let us kind of talk a little bit about what we're experiencing, because it's the way to enter into people's personal private space.
yeah.
But I certainly appreciate something you said, and I think this is a reminder for those of us in the helping professions, right? And you said three things that I think really stood out. I particularly appreciated so much focus on the person, right? The individual, recognizing that it's about the person you're serving. In the field, we sometimes call it as patient-centered or client-centered, but that's spot on, right? It's about that person, that individual, because it's their life situation, right? There's a Spanish proverb that kind of speaks to that, and I'll say it in Spanish and English, by the way. It says que cada cabeza es un mundo. Each mind is its own world. And that's right. So the person has their own set of circumstances and situations. And then you went on to say the second thing, which is, what is it that they're seeking, right? I think you refer to it as their goals, but it's their goals, not the agent's. That has great significance, because when the focus is on the person, what it is that they want to change or see different, that's a perfect example of how it is that people seek help and then get help. And then lastly, it was great to hear about the way the team works, right? And a care coordination model between different team members. And that was just excellent. And all I could say is that you have both really kind of helped to shape not all only about the work you're currently doing here in New Mexico, but your approach and the fact that you're available. So let's talk a little bit about how people can connect to you. And then we're going to end with your takeaways for the day, because now folks who are going to hear this recording can tell their mom and dad, I was just watching a portion of Pláticas, and what I heard was there's a company in New Mexico that's available to be of help and service. And of course, mom and dad might say, well, I don't know. I don't know how to get hold of them, or what am I supposed to do? And that's okay, right? Let's give people the recipe, right? Let's not keep the recipe. Let's give them the recipe. So Rose and Amalia, if you want to kind of highlight how people can reach out to you, and then we'll make sure it's in our live Facebook links so that people can know how to do that in different ways to get hold of you. So go ahead and tell how we can connect to you.
Oh, perfect. Thank you, Fred. Both of our emails will be in the chat. And then another place you can find information about Western Sky is through the link that we provided for the value-added services. That's our website. So you can click around and get some more information. There's a member services number there. That's a great number if you're not sure where to go also. They will get you to the right place. But happy to answer any additional questions or provide any support. And of course, hablamos español, right? So you can call us. We'll speak whatever language we need to connect with our members. We have interpretation services to support any and all languages, and that includes sign language, hearing impaired support. So please don't hesitate to reach out to us. Our goal is to meet our members where they're at. I think Amy said that really well. And that's wherever they're at in the moment. They're needing the help. And Fred, if you don't mind, before we go on to what do we do to ensure that we help ourselves and the people around us with social connectedness, right, which will be the big takeaway here. There is also one additional program I want to highlight. We brought it on to address social isolation with our members, and it's called PICS. Yeah, so it's specific to this. It's called PICS Health. So that's PYX Health, and it is a vendor that we brought to New Mexico. The vendor helps provide an app, like a mobile application, where our members have access to different ways of assessing if they're lonely. So it just will ask questions, and then it guides them through other activities. And then there's also some really great activities for what they have found evidence-based that helps people feel even less lonely in a digital world. So you can adopt a digital pet and name it and feed it. I don't know if you guys remember, a long time ago we used to have the Tamagotchis. It's kind of like that, but it's a digital pet through the app, and you can pick a cat or dog and then name it, and it's really creative. But really, the most important thing about PICS Health is they have what we call the Compassionate Care Center. These are live people that our members can call 24/7 and talk to a live person, and the discussion is a chat. It's not time limited, hurry, get off the phone, and trying to target one thing I need to help you with, and then I'm going to move on. They literally can call and just chat. How's your day been? Tell me about your digital pet. Tell me about your grandchild's birthday. Tell me about school difficulties, like whatever it is. It's a compassionate care center. Call me about anything. We can talk for as long as you need. And it's to address social isolation. So it's that connecting socially with someone over the phone, to share and be heard, right? Like you said, Fred, it's just so important that people feel heard, and that caring conversation is really important. So PICS Health provides that to our members. So not only the digital app, which helps members, screen themselves. And what's interesting is, if I were to get on the digital app as a Western Sky member and I answered questions that showed that I was lonely in the moment, right? Lonely, that center calls me and goes, hey, we saw you use the app. How can we help you? How's it going today? And literally just they reach out to me also. So I'm not always having to reach out to them. So it really is people are there and they're waiting to support. We really have found it to be a very beneficial thing for our members. At this point in time, we have over 1,000 members that have benefited from that support.
Huh.
So it's been wonderful. Yeah.
Oh, that's super. And you're absolutely right. They have things like pet therapy, right? And it's been around for a number of years, right? But people learned really that, the attachment that people have to pets oftentimes is their lifeline. It's the one part of their life that they have such a deep emotional connection to, because the pets are so compassionate, loving, and empathetic towards the person who holds them and feeds them, right? So, well, I think I would want to look at that, because if there's a way to adopt a parrot, but so that I don't have to do any of the other types of things associated with parrots, I'd be very interested, because part of that, we have a love for animals, right? I can't keep a horse, which is a powerful animal to have, right? But it's right, it's that connection, it's that bonding, right? And to those things that have meaning in our life. Well, Amaya, you might have another example that you might want to share, right? But anything else you'd like to add to this portion, Amalia?
No, I mean, just the information that Rose shared, and, just in case for those individuals that might not have access to the internet, or are, technically challenged, you can always also call the member services number behind their member ID card, and that will get them connected to, whether it's us with member connections or care coordination or any other department. They're really good in connecting them to the appropriate department. So yeah, just giving that shout out to them.
Oh, very cool. Well, a reminder to our Facebook audience who's listening today, and also will be listening as part of the recorded replay of today's Plática. Again, we're here with Rose Nelson and Amalia Ontiveros, who are just been phenomenal in sharing about the incredible connectivity they're making in communities across New Mexico. So besides saying thank you, one of the things that we'd like to do is say, if there's one thing you want the live Facebook audience and the actual Facebook audience who will listen to this after today, what takeaway would you like them to have? Because I think both of you are doing such incredible things that you probably want to emphasize something that's important that they can take away from today, because part of what this Plática does is information, it's education, and these are very basic, in fact, but they're so essential to connecting people to the service, right? You have to have that information and that education to connect to those resources. You're doing that for us today, and for many hundreds and thousands of individuals in New Mexico, by being able to share this information. But what is a takeaway you'd like for the Facebook audience to have? And we'll start with you, Rose.
Yes, thank you. In honor of Loneliness Awareness Week, if I can ask everybody to think about your circle, right? So these are the people that are in your life. Take the time to think about who would benefit from a call from you today, right? An outreach saying, hey, I was thinking about you, and I just wanted to say hello and see if I could help you in any way. That could be all the difference in the world to even just one person, and that makes such a huge difference. It's a ripple effect, right? Because as they feel better about that, they might do the same thing. And so it's that pay it forward kind of situation. But then I'll also say, if you feel that that would be helpful to you, don't hesitate to reach out to someone that you trust and know. And that includes, if you're part of Western Sky, reach out to us and we want to provide that support, but reach out and ask for help, right? We want to remove that stigma to say that we shouldn't be asking for help. Asking for help is absolutely okay. We want people to ask for help when they feel that they need it. And Western Sky is here to support you and our members at any point in time that you may need help. But that would, I would say, would be the most important takeaway.
Awesome. Very cool. Well, Amalia, of course, we want to ask you the same question, because I think, if you think about, you're taking time to be here with us, welcome. It's good to meet you, and thank you for doing the work you're doing out in the southern part of the state and anywhere else for that matter. But it's good to have you here today. And so if you think about what is the takeaway for the listening audience from your perspective, What would you like to say?
Yeah, I mean, I definitely want to echo what Rose had mentioned, that, something that we continually work towards, whether it's at events that we're at or speaking with individuals one-on-one, is, again, just like how you go and visit the doctor when you're not feeling well, it's the same thing when you're emotionally not feeling well, right? When you're feeling a little sad. And so reaching out, getting connected, making sure that you do have those supports available to you, and getting connected when you need to, and of course, reaching out to us. We'll be more than happy to help you out and provide the support that you need, again, based off of what their needs are.
Wow, incredible. Well, I can't say thank you enough. And again, this is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. We want to thank our guests and presenters, Rose and Amalia, for being here with us today, and particularly now during what is Loneliness Awareness Week. That'll be June 12th through the 18th. But even though we pay particular attention to this during that period of time, we really pay attention to this throughout the year. And what's important is that the information that you received today is going to be something you can pass on to those that you know. And as Rose suggested, is we can make a phone call or a text, and that in of itself will probably do such incredible wonders for that person, because one, they weren't expecting that call or that text or that little visita, right? Or you drop by at their house and they said, "Oh my God, look who showed up at my house," because that is the connection that strengthens our community. So when we strengthen our community, those bonds mean everything to the people whose well-being we're trying to support. So again, this is Fred Sandoval from the National Latino Behavioral Association. Thank you to all of you who are on today's Plática, and we'll get to see you soon. But for today, muchísimas gracias, Rose and Amalia. Thank you so much for being here with us today. Bye-bye.